I read an interesting article on Talking Points memo by Sahil Kapoor about why overturning Obamacare could actually lead to single payer. And the argument, Lewis, is that if the Supreme Court does decide to strike down Obamacare, Republicans will no question claim a short-term victory. But they could end up losing in the long run, because then the future of the nation's healthcare system would definitely be in even further disarray. Okay, given that many millions of Americans thought that this Obamacare, so-called Obamacare, would become the law. And it could end up, Adam Winkler said, and he's been a guest on the show, he's a constitutional law professor at UCLA, saying that conservatives may find that they weren't careful about what they wish for in opposing Obamacare. It could lead to even more economic, social, and political pressure for healthcare reform, and potentially lead to Medicare for all, which would have no constitutional issues. We know that that's constitutional because Medicare already exists, and it would be just an expansion of it. Or of seeing more states do what Vermont is attempting to do, instituting a state-run single-payer healthcare system. And those are both two that conservatives will not really be able to get thrown out as unconstitutional, particularly the states option, because it's basically federalism at the highest level. Something presumably conservatives are in favor of.
Right. Yeah, I mean, I guess really what we're all waiting on is for the Vermont thing to kick in and see what happens.
No question.
And I believe that's still, what, 2 years away?
I think it's 2014 at the earliest that it could go, yeah.
So, unfortunately, I think it's going to be a while. And I don't think overturning Obamacare in between that amount of time is going to have huge negative effects on the economy via the healthcare system. So, yeah, I mean, I think really it's all up to Vermont.
The other thing on this is I don't really think, for people who are just saying, hey, when we get more Democrats elected, this thing will finally happen, because we couldn't even get a public option, Lewis, when Democrats had 60 votes in the Senate. We couldn't even get a public option within the for-profit healthcare system. I don't think, Natan, that really waiting around for Democrats as a solution is a viable option, really.
No, and I think that Democrats, if they're smart, if the healthcare law is struck down by the Supreme Court, they should be smart and say, they need to man up and finally start supporting what they really believe in, or what the majority of Democrats believe in, which is a much more leftist option than this sort of Republican idea, which they failed to support, which is Obamacare.
Yeah, and Lewis, I mean, we know that because of re-election campaigns, Democrats and Republicans and moderate Democrats alike, they're all scared to really do anything that would raise any eyebrows and jeopardize their re-election campaign. Yeah,
we can't invest anything in Democrats, because once they reach office, they're really operating very closely to the Republicans.
With few exceptions, particularly on social policy.
I guess, yeah. But, I mean,
there's a significant difference on social policy.
Right. And, I mean, basically what you're just saying is there's a lack of pushing a social agenda when it comes to the Democratic side. The Republicans are pushing one. The Democrats aren't doing anything, really.
And last thing, remember, this is a court, the Supreme Court, that probably would have found Medicare and Medicaid unconstitutional had they heard those cases initially. And this is probably a lot of the reason why you hear Antonin Scalia's comments and questions being so pointedly anti-Medicare during the hearings about health care.